Ever think about those beautiful, seemingly perfect natural spots? Quiet woods, maybe a calm lake, places that feel just wholesome.
Absolutely. Peaceful.
But sometimes nature has these hidden challenges. Today we're going to dive deep into one, blastomycosis. It's a systemic fungal infection.
Mm-hmm.
Our sources really zero in on how it affects dogs, primarily, and sometimes cats, too.
Exactly. We've been through the material and, well, the mission for this deep dive is to really get a grip on blastomycosis. What is it? How does it impact animals?
Where does it hide out?
Right. Where is it found? And
Yeah.
crucially, what can we actually do about it? And we
Yeah.
want to do this without, getting totally bogged down in medical jargon.
Okay, perfect. So let's start right at the source. The culprit, Blastomyces dermatitidis. What is this thing?
Right. So Blastomyces dermatitidis is, well, it's a fascinating fungus. It's dimorphic, meaning it has two forms.
Two forms, okay.
Yeah, in the environment, in the soil, it exists as this branching thread-like structure that's the mycelial form. And this form produces tiny spores called conidia.
Ah, and I'm guessing those are the troublemakers for pets. How does that happen?
That's exactly right. An animal, often a dog, is just sniffing around, maybe digging a little, inhales these microscopic conidia from the soil.
Just normal dogs.
Totally normal. The spores then travel down into the lungs. And here's the key bit. Once they're inside the warm body temperature triggers a change.
They change into what?
They transform into a yeast form. And this yeast is what actually causes the infection, usually starting right there in the lungs, often looking like pneumonia initially.
So it kicks off in the lungs, but it sounds like it might not stay there.
Often doesn't know. These yeast cells can get into the bloodstream. We call it hematogenous dissemination.
Meaning they travel through the blood?
Precisely. They hitch a ride in the blood to potentially reach, well, almost any other part of the body.
And how does the animal's body react? Does it try to fight back?
Oh, absolutely. The immune system definitely responds. It tries to contain the yeast by forming these clusters of immune cells called pyogranulomatous infiltrates. Think of it like building a wall around the invader.
Okay, like trying to trap it.
Exactly, trying to wall it off and control it.
Got it. So we know the cause, how it gets in, how the body fights. Now, where does it actually end up causing problems? The sources mentioned quite a few spots.
Yeah, the lungs are definitely ground zero. About 85% of dogs with blasto show respiratory signs. But it's quite versatile, unfortunately.
Beyond the lungs, then.
Oh, yes. Very commonly affects the eyes, the skin, the tissues just under the skin, lymph nodes, tests in male dogs, the central nervous system, brain, and spinal cord and bones, too.
Wow, that's a lot of systems involved. Any less common places?
There are. Less frequently, we see it in the prostate, mammary glands, nasal passages, gums, even the heart muscle sometimes, or the vulva.
And is it possible for an animal to have it and not show signs, like a silent infection?
It seems pretty uncommon for blasto. Most animals with the infection do show signs of being unwell. Subclinical infection isn't something we typically see with this one.
Okay, that's good to know. This really sounds like a major health issue. It makes you wonder, where is this fungus actually lurking? What kind of places does it prefer?
Its presence is really tied to the environment. Specific soil and environmental conditions seem to favor its growth.
Like what? What is it like?
It seems to prefer sandy, acidic soil, and there's a really strong connection to water.
Water sources, like rivers, lakes?
Exactly. Think riverbanks, lake shores, maybe swampy areas. The classic endemic areas are the Mississippi, Ohio, and Tennessee river basins.
Ah, the major river valleys.
Right. Also the Great Lakes region, the St. Lawrence River area, parts of southern Canada, and down into the mid-Atlantic states too.
So those are the hot spots.
Those are the main ones, yeah. But it does pop up elsewhere occasionally. We've seen reports from places like Colorado, for instance, which are outside those traditional zones. It's likely that specific mix of soil, moisture, maybe temperature.
So if you're living near or visiting those kinds of areas with your pets, the risk is potentially higher. Okay, who's most likely to get sick? Which animals?
Well, the data clearly shows dogs are the primary species affected. Cats can get it, but it's much, much less common.
And within dogs, any particular types?
Yes, there seems to be a predilection for larger breeds. Dogs over, say, 25 kilos or about 55 pounds. And sporting breeds often come up in reports.
Sporting breeds, like retrievers, pointers.
Exactly. Which kind of makes sense, right? They're often spending more time outdoors, exploring environments where they might encounter the spores, more exposure risk, potentially.
That does make sense. What about age or sex? Any trends there?
For dogs, yeah.
Yeah.
That's most commonly
Okay. So it really sounds like environment and lifestyle, like that lab loving the river you mentioned, are big factors.
huge factors.
Yeah.
Living near or frequently visiting wet environments, riverbanks, streams, lakes, swamps, is a major risk. One study noted most affected dogs lived within about 400 meters, like a quarter mile of water.
Wow, that close.
Yeah. And also, areas with recent soil disturbance, like construction sites or excavation, might pose a risk too, stirring things up.
Right, releasing the spores.
Could be. And it's worth mentioning, though it's rare, even indoor-only cats have occasionally been diagnosed, so spores can potentially be tracked inside, maybe on shoes or clothes.
Huh. Okay, good to know. So knowing the risks and locations helps, but what about the actual signs? What might an owner see at home if their pet is developing this?
Okay, so things owners might notice. Weight loss is a common one, sometimes despite a normal appetite initially. Decreased appetite or anorexia,
A persistent
like a
cough.
dry cough, can be, or sometimes productive. Difficulty breathing, maybe faster breathing, or more effort. Eye issues are a big flag: inflammation, redness, discharge, squinting,
Oh, okay.
lameness if a bone is affected.
Oh,
Sometimes you might see skin sores, often little draining tracts or nodules, and in rare cases, if the heart's involved, you might even see fainting spells, syncope.
wow. Okay, a lot to watch for. And what about at the vet's office? What might a vet pick up on during the exam?
In dogs, a fever is pretty common, maybe up to 104 Fahrenheit in about half the cases. The vet listening to the chest might hear harsh or abnormal lung sounds, crackles maybe,
Yeah.
obvious increased respiratory effort.
Mm-hmm.
Enlarged lymph nodes are another key finding. Could be generalized or just regional near a skin lesion, for instance. Those eye signs we mentioned, uveitis, inflammation inside the eye, maybe glaucoma secondary to that, cloudy cornea, discharge, very common.
And the lameness.
Yep. If there's bone involvement, which happens in up to maybe 30% of dogs, less often you might find enlarged testicles or an enlarged prostate on rectal exam, and super rarely a heart murmur or irregular rhythm if there's endocarditis or myocarditis.
And for cats, similar things.
The top findings reported in cats tend to be the respiratory signs, increased breathing effort, plus those skin lesions, often granulomatous, sort of lumpy and inflamed, and signs of vision problems.
Okay, so if a vet suspects blasto based on the history and these exam findings, how do they actually confirm it? What's the diagnostic process?
Well, first you have to think about what else it could be, right? The differential diagnoses. For lung signs, could it be bacterial pneumonia, cancer, heart failure, fluid in the chest, maybe another fungal infection like histo or crypto?
Right. Rule things out.
Exactly. And enlarged lymph nodes could be lymphoma. But
Yeah.
when you see that combination, especially in a younger, large breed dog, of respiratory signs plus eye problems or bone lesions or skin issues, blasto jumps way up the list.
It becomes a strong suspect.
Okay. What about basic lab work? Blood tests, urine tests, do they help?
They can provide supportive clues, definitely. A CBC might show signs of inflammation, maybe mild anemia if it's been going on a while.
Okay.
The chemistry panel often shows high globulins. Those are inflammatory proteins, sometimes with borderline low albumin.
Okay.
Some dogs, maybe 10–15%, have mildly elevated calcium related to the granulomatous inflammation. And interestingly, if the prostate is involved, you might actually see the Blastomyces yeast cells in the urine sediment. Mild protein in the urine isn't uncommon either, just from systemic inflammation.
Are there more specific tests that really point the finger at blastomycosis?
Yes, absolutely. The antigen tests are very useful. You can test urine or serum for Blastomyces antigens. These are great if you haven't found the organism itself on cytology yet.
How reliable are they?
Generally quite good. Sensitivity is reported over 90%. A positive test is strongly supportive. Some sources suggest the urine antigen test might be slightly more sensitive than serum.
Any downsides? The main one is potential cross-reactivity with histoplasma, another fungus. So a positive result means either blasto or histo, usually. There's also an older antibody test, AGID, but it's not very sensitive early on, though quite specific if positive.
Got it. Antigen tests are key. What about imaging? X-rays must be important, especially with lung and bone signs.
Oh, crucial. Chest x-rays or radiographs often show a characteristic lung pattern. It's typically described as a diffuse interstitial to nodular pattern. It can look like little snowballs scattered throughout the lungs sometimes.
Yeah, like typical pneumonia then.
Often doesn't look like a classic bacterial pneumonia, no. And the lymph nodes in the chest, the tracheobronchial nodes, are frequently enlarged too. The pattern can actually mimic metastatic cancer sometimes, which can be tricky.
I can imagine.
And very rarely, you might see fluid buildup, chylothorax linked to blasto. For bones, X-rays can show lesions that are both destructive and gelitic and proliferative, where new bone is forming. Again, can sometimes resemble bone cancer, like osteosarcoma.
So, imaging gives strong clues, lab tests add more evidence, but it sounds like actually seeing the fungus is the gold standard.
That's the definitive diagnosis, yes. Finding the organism itself. Cytology is often the quickest way.
Looking at cells under the microscope.
Exactly. From a fine needle aspirate of an enlarged lymph node, or fluid washed from the airways, a tracheal wash, or even just an impression smear from a draining skin lesion.
Okay.
Histopathology, examining a tissue biopsy, is another way.
Mm.
Maybe a bone biopsy if there's lameness, or even an eye if it's blind and painful and needs removing anyway.
Mm.
The organisms are usually pretty numerous in tissue lesions.
Easier to find in tissue than, say, a lung wash.
Sometimes, yeah. Especially if the cough isn't very productive, you might not get many organisms in a tracheal wash sample.
And what do they look like, these yeast cells?
They're quite characteristic. You see that pyogranulomatous inflammation we talked about, and within it, these yeast cells. They're typically round, about 5 to 20 microns across, so fairly large for yeast.
Big.
And the key feature is their cell wall. It's thick, double-contoured, refractile, meaning it shines under the microscope light. And you often see them budding, making little daughter cells. Look for a broad base on that bud.
Broad-based budding. Got it.
Sometimes, especially in chronic lesions, there might be a lot of fibrous tissue and fewer organisms, so you might need special fungal stains like GMS or PAS to make them stand out.
Okay. So once the diagnosis is confirmed,
Yeah.
what's the plan? How do we treat this?
Treatment involves supportive care and specific antifungal medications. Nursing care is huge, especially early on.
Like what kind of support?
Well, if a dog is really struggling to breathe, oxygen therapy might be needed, maybe for a few days. And owners need to be prepared.
Mm-hmm.
Sometimes dogs can seem a bit worse in the first few days of medication.
Really? Why is that?
It's thought to be the inflammation flaring up as the yeast cells die off. So it's important not to panic, but monitor closely. Activity restriction is key for any pet with breathing issues. And encouraging appetite with a really palatable, high-quality food is vital.
And you mentioned reassuring owners.
Yes. It's crucial to let them know their pet isn't contagious to them or other pets. The risk is shared environmental exposure, not pet-to-pet spread. And also, be upfront about the treatment. It's often costly and takes a long time. Minimum 60 to 90 days.
Wow, months.
Minimum. Often longer. Surgery sometimes comes into play too, maybe removing a badly damaged lung lobe if meds aren't enough, or enucleating a blind infected eye, as it can be a source for relapse.
Okay. What about the actual drugs? What antifungals are used?
The main drug, the ozil of choice generally, is itraconazole. There are specific doses for dogs and cats. For dogs, it's often recommended to give it with a fatty meal, at least initially to help absorption.
Avoid antacids, too.
Correct. It needs an acidic environment. And again, treatment needs to be long, at least 90 days total, and usually for 1 full month after all signs have resolved.
So even when they seem better, you keep going.
Absolutely. And a really important point, use a reliable formulation. Compounded itraconazole can be really variable in quality and absorption, so it's often best to stick with the FDA-approved veterinary product if possible.
Good tip. Are there alternatives if itraconazole isn't suitable?
Yes, fluconazole is another azole option, often less expensive, which is a factor for long-term treatment, but it might take even longer to clear the infection compared to itraconazole.
Okay. And what about really severe cases?
For dogs with life-threatening disease, maybe severe lung compromise or neurological signs, or if they aren't responding to the azoles, then intravenous amphotericin B comes into play.
That sounds serious.
It is. It's a powerful antifungal, but it can be tough on the kidneys. There are lipid complex formulations available now which are much safer for the kidneys, though more expensive.
What about steroids? Corticosteroids. Do they have a role?
Generally, no. You want to avoid suppressing the immune system when fighting a fungus. Steroids can let the Blastomyces run wild.
Okay, makes sense.
But there is one exception. For a dog in a severe respiratory crisis, truly life-threatening difficulty breathing due to lung inflammation, a very short course of a potent steroid like dexamethasone might be used cautiously alongside the itraconazole just to dampen that inflammation quickly.
It's just temporary crisis management.
Exactly. Tapered off very fast. It's a careful balancing act.
Are there common side effects owners should watch for with the azoles, like itraconazole or fluconazole?
The most common is probably reduced appetite or anorexia. This can sometimes signal liver irritation. So monitoring liver enzymes, especially ALT, monthly or if appetite drops, is important.
What if the liver enzymes go up?
If they climb significantly along with poor appetite, you might need to stop the drug temporarily or reduce the dose. Another potential side effect, maybe more with the traxiconazole, is a specific type of skin lesion, ulcerative dermatitis. Seems dose-related. Again, might need a dose adjustment.
And amphotericin B kidneys are the main worry.
Definitely. Cumulative nephrotoxicity kidney damage is the primary limiting factor. So very close monitoring of kidney values, like creatinine, is essential during treatment.
Okay. So once treatment starts, how do vets track progress and decide when to stop? You mentioned needing to treat past resolution of signs.
Right. Regular rechecks are key. Monthly blood work for liver enzymes, as we said, and chest x-rays are really important for monitoring lung disease and guiding treatment duration.
How do x-rays help decide when to stop?
It's tricky because some lung changes, like scarring, might be permanent even after the infection is cleared. But the general idea is you take x-rays, say, after 90 days of treatment. If the lungs look normal, maybe stop treatment and recheck x-rays a month later. If they still look normal, great.
What if they don't look normal at 90 days?
If there's still evidence of active disease, you continue treatment for another month and reevaluate. If the x-rays look better at 120 days compared to 90 days, you keep treating. If they look the same and the animal is doing well clinically, the changes might just be residual scarring.
And if they get worse?
If they significantly worsen between 90 and 120 days despite treatment, that might be a time to consider switching to amphotericin B. Basically, you treat as long as things are improving and there's no sign of active infection. Once things stabilize and seem inactive, any remaining changes are likely just scars.
It sounds like a really involved monitoring process.
It is. Requires commitment from both the vet and the owner.
Given how serious this is, and the environmental link, people must ask, can we prevent this? Can we avoid exposure?
That's the tough part. Because we don't know the precise micro-locations where Blastomyces thrives, pinpointing specific spots to avoid is really difficult. Telling people to keep dogs away from all water or woods isn't practical or often feasible.
So not much we can actively do for prevention.
Not easily, no. One interesting point from the sources is that dogs who recover might develop some immunity against reinfection, which is good news for them.
Okay, so looking at the bigger picture then, what's the expected outcome? The prognosis?
It needs to be said, the prognosis can be guarded, especially early on. The sources mention mortality rates around 25% in the first week of treatment.
Wow, that high.
It really highlights the severity and the importance of catching it early. Early diagnosis and starting treatment promptly definitely improve the odds. Factors that worsen the prognosis include very severe lung disease and any involvement of the central nervous system.
Does it ever come back after successful treatment?
Recurrence is possible, yeah. It happens about 20% of dogs, typically within 3 to 6 months after stopping meds, but sometimes later.
And if it comes back?
The good news there is that usually a second round of azole treatment is effective. We haven't really seen drug resistance becoming a major issue, thankfully.
What about cats? Similar outlook.
For cats, if it's caught early, the prognosis seems generally similar to dogs.
This has been incredibly informative, a really deep dive. To sort of wrap it all up, what are the absolute key takeaways for our listeners?
I think the main points are blastomycosis is a potentially serious fungal infection, strongly tied to specific environments, think moist, acidic soil, often near water. Dogs get it most often, but cats can too.
And it has recognizable signs.
Yes, things like persistent cough, breathing issues, eye problems, skin lesions, weight loss, and crucially, effective treatment is available with antifungal meds, but success really hinges on early diagnosis and long-term commitment to treatment.
So awareness is key, especially if you live in or travel to those endemic areas. We talked about the river valleys, Great Lakes region.
Absolutely. Vigilance is important. If your pet, especially a dog fitting the risk profile, shows suspicious signs, getting them checked out by a vet promptly is the best course of action.
It really does make you appreciate the complex dance between the environment, these invisible organisms, and the health of our animals.
Doesn't it? Understanding these connections, even the hidden ones, helps us be better guardians for them.
Definitely. It kind of leaves you thinking. What other environmental factors subtly influence health, and just how resilient is life, adapting to all these microscopic challenges? Something to ponder.